What's going on, everybody? John Stamper with ADOM TV, and very excited to be coming to you to share some more great information as we continue this ADOM TV series. And very excited today to have with me Ben Nielsen, who is one of the senior product managers at Henry Schein One. And today's episode is going to be talking about improving the patient experience through electronic prescribing. And so for many of you out there that are familiar with Henry Schein One and Dentrix and all of that, there are some really cool features that have been added to the platform that you can use in your practice all around electronic prescribing. And for many of you out there, as you know, this is becoming a very popular topic, especially as many of you in practices are having to deal with this in regards to prescriptions and all the electronic pieces of it and things like that. So Ben, thanks for coming on, man.
Yeah, thanks for having me, John.
All right, so what we're going to do, everybody, is just a little bit about some of the learning objectives. Ben's going to touch on how you can help control opioid and other prescription drug abuse through electronic prescribing, and certainly some of the benefits of that. He's going to touch on some of the state and federal mandates, and then finally, how you can help your patients by sending their prescriptions directly to the preferred pharmacy, and then providing them a prescription cost up front so that they know right off the bat there's no surprises when they get there. Before we get into that, very, very interesting information. Ben, I'd love to have you share with everybody a little bit about your history and how you got to where you are.
Okay, cool. Yeah, so I've been with Henry Schein One for just over 2 years. Last week was my 2-year anniversary.
Oh, congratulations.
Thank you. It's a big time. But before I was here, I was a product manager at a couple other companies that worked. I was working a lot with different types of integrations with systems that for the companies that I was working with. So integration is kind of my big thing, and in this case, integration with an ePrescribe system is where I've landed. So I do this here at Henry Schein One, work on ePrescribes for our practice management systems, and then I also do some other projects for our Dentrix Ascend, our cloud-based software. And so just overall, working on a few different projects for practice management.
Awesome. All right. Well, appreciate that. And yeah, I know you guys are super busy, like you mentioned, adding new features, to the main platforms all the time, and all in an effort to be able to help out a lot of the dental managers. And I know they appreciate it. So, all right, let's get right into it. So the first question that I have for you is along the lines of security. I'm sure you guys get asked this a lot. Okay, we're going to move towards electronic prescribing, but talk a little bit about the security and what that means, and some of the things that you guys have done to make sure that everybody knows that there's safety to kind of go down this process.
Yeah. Well, actually, that's one of the biggest things. One of the biggest reasons why ePrescribe is so big lately is that we need a lot more security in issuing prescriptions. And so, there's a lot of concern about, just giving a piece of paper or a prescription pad or to the patients to take out to the pharmacy and get filled. And so ePrescribe is really the means to have a really safe, secure way of issuing a prescription. So one of the concerns that people have is, well, in order to send a prescription, you need to make sure that you're a provider and that you have the right credentials. And so in ePrescribe, all the ePrescribe systems have ways to get this assurity. There's two-factor authentication or multi-factor authentication to verify that you are who you say you are, right? Mm-hmm. And here at Henry Schein One, we use Veradigm is the name of the company that of the e-prescribing software that we use. Mm-hmm. They have a way to do some identity proofing or identity verification using a tool called ID.me, and it goes through and it checks, asks each provider questions. You have to provide your NPI number and your DEA number, and then answer other questions about yourself, like where did you live 5 years ago, and things like that. Questions that only you will know. And then once you've verified your identity, then you can issue prescriptions for your patients under that identity. And so, so I think that's the big first thing about security, is that making sure that you're an authorized prescriber that can send these, and that's being tracked and going through the correct authentication means to be able to send that prescription out.
Yeah, and so you touched on a little bit, certainly, Henry Schein One's involvement in this process. And I'm curious, just with the ramp up in so many states, in regards to, for example, the opioid crisis and the responsibility now that the practices have to have, the providers have to have when it comes to prescribing and those protections. But talk a little bit about Henry Schein One's involvement and the importance of you guys being involved in this electronic prescribing arena.
Yeah, well, it really started kicking up probably about 5 years ago. I think it was in 2014 or 2015 that New York State started with one of the first mandates in the country to say all controlled substances must be prescribed electronically. And we had a partnership back at the time. They called the tool Allscripts. They've gone through a rebrand now. It's called Veradigm. But we had a partnership with them, and we built an integration in between Dentrix and Veradigm so that you could, within the same workflow, send a prescription as you're taking care of your patients, as you're charting their needs, and working within Dentrix, you could send a prescription right from that workflow over to the pharmacy. And so, like I said, it started in New York, and we have a ton of practices in New York that needed this capability. Since then, even just last year, there were like 7 or 8 more states that came on board with mandates of their own, and they all have the same requirements. There's another batch of states that have requirements here at the end of the year. And once again, like all providers, it's becoming more and more, all providers need some way to send out electronic prescriptions to be able to cover these mandates. And so our involvement at Henry Schein One is that we want to provide the best solutions that are needed to run a dental practice. And so we sell, e-prescribe under that label, so that when a dentist is going through and using the practice management, then it's really easy, and it's not some other system that you have to go log into and figure out how to use. It's all from within Dentrix, and right. You can send that prescription. It goes really easily to the pharmacy. You don't have to give anything to your patients. They don't need to worry about taking it over to the pharmacist to get it filled and then going to pick it up later. They can just run right over, and then usually, however long it takes for the pharmacy to get that prescription ready, they can pick up the prescription. It makes it really simple for their lives.
Yeah, I think what's exciting, as you mentioned, is that Henry Schein One is continually adding so many of these applicable software resources, right, for a lot of the Dentrix customers. So what has it been like? I mean, those, Dentrix customers that have been using it for so long, and then, there's different needs that come about. But what has it been like, at least with ePrescribe, in regards to a lot of your current Dentrix customers, and what's been some of their feedback?
Well, I think that people, sometimes it's not always cool when the government feels like the government is mandating you to do something. But in this case, I think it's good for everybody. And the feedback that we get is generally that it's much easier to do it from within the practice management tool than right. to have some other system. I mean, because you're doing it right from the workflow that you're already in, right? All the patient data that needs to be sent along with a prescription, that gets entered in. Yeah. One system that a lot of dentists have to log into every time they send do some sort of controlled substances, they need to go check their state PDMP, the Prescription Drug Monitoring Program. And these are databases that each state has. Well, we've made that more simple to check by just pulling in that data into our ePrescribe system. Mm-hmm. So we're really trying to reduce the amount of work that it takes. And that's the feedback that we've got, is that it makes it really a lot more simple and an easier mandate to fulfill or to obey and to follow when there's an easy workflow that goes along with it.
Right. Yeah, that's a good point. It's I'll get more frustrated if I have to do it if the process is not easy. But thank you, Henry Schein One, for making that easier. And one of the things that we touched on at the beginning was providing the patients the ability to know the cost up front. Can you touch on some of those features and the benefits of that?
Oh, yeah. So one benefit that doctors get to better service their patients is that we offer a true price RX, I think is what it's called, where mm-hmm. there's a little module, you pick whatever the drug is that you're going to send out, and it'll go and do a check on pharmacies nearby to see what the prices are, so that you can compare and say, well, over at Kroger, then it's this price, or over this, right. It'll give you a list of a few pharmacies that the patients can then choose from. I heard a stat a while ago saying that a lot of people don't follow their prescriptions as written because it's either too expensive or they don't know, yep. Where it's best to go get the prescription. And so we using this tool, the dentist can give so much more information to the patient to make that decision. They'll be able to go and get those prescriptions more likely.
Yeah, I love that service. It takes me back to times when, quite honestly, my wife will call me and she's at the pharmacy and she's like, "Oh my God, you're not going to believe this. I didn't know when I was at the practice, but this prescription is this or this much or what have you." And so just thinking through this such valuable resource for them to know in the practice, because you're right, Ben, in a lot of cases, by the time they get to the pharmacy and they're there and they're home, if it surprises them, they don't know those prices, they don't move forward with that. And that could be the difference, right, between them getting better quicker, having to go back into the practice. And so, like you said, having that transparency up front in the practice is a super valuable resource. It's really cool.
Yeah, I would add, we had the flu at my house this last week. And so when we went to, I went to the doctor and they're like, "Here, there's this new flu medicine you can take." And they, the doctor was telling me the prices. And I was like, that doesn't sound quite right, because last time I had the flu, it cost way more than what you're telling me. Right. And I went to the doctor, went to the pharmacy, and again, it wasn't anywhere near what the doctor was saying. So it really, I think this gives the doctor, a line of credibility a little bit, where they know what they're talking about because they pulled up the prices and you go and see those prices match. So it's, I think, a huge benefit for the patient and for the doctors.
Yeah, I love that. All right. So as we close out here, I know a lot of times you as a senior product manager, you're in there making sure all the pieces and parts fit right with the Dentrix platform and a lot of these new exciting resources. How often do you get the opportunity to get feedback from a lot of the practices and the Dentrix customers? Because I've been sharing with people lately, I really see this gap closing between feedback from the practices, companies like Henry Schein One, where you guys are listening, trying to understand what works for them, especially with technology, as you know, Ben. You can't make a right turn immediately if somebody makes a request, but technology certainly is a little bit more fluid than is, particular products. So what's that experience been like for you, especially now you're there 2 years? You guys are doing some great things. What's it like from the eyes and the ears of a product manager when you're, trying to put all these pieces together and serve, practice managers and that across the country?
Yeah, it's an interesting question. There's a lot of ways that we try to get feedback. We want to keep our ear to the rail as much as we can and know what's coming and respond quickly to user feedback. And so there's a number of strategies that product managers will use to get that. We go to a lot of shows. We go to places where dentists naturally gather. I was in Boston 2 weeks ago at the Yankee Dental, and I was able to talk to a lot of people who gave feedback on, "Hey, I really like this," or "I wish that something different. I wish this was different about the tool." Right. And that, especially about ePrescribe, because Massachusetts is one of those states that has mandate that's come up. So we've been out talking to a lot of these dentists, and so there's a number of ways, like I said, that we try to get this feedback. One that I really love is just a phone call. Good old-fashioned phone call over the phone. We'll talk about the needs, and it really opens the door for not just the feedback that I think that I want to hear, but feedback that the dentists are more ready to give. And that's when I get the golden moments where I'm learning quite a bit, and I can inform my research a little bit more strongly later on. Well, I hear a lot of people asking about this topic, so I'll ask more questions about that and dig deeper and know where I can put together surveys and different means to gather that feedback. So yeah, I would say it's easier than ever to get this feedback from users, and we try to get as much of it as we can and put it together in meaningful stories for ourselves to make the right improvements to the products.
Yeah, that's awesome. So you heard it, ADOM members, old-fashioned way, pick up the phone, call Ben. He's there to help and support. But no, seriously, Ben, let everybody know how they can learn more about ePrescribe and Henry Schein One and any of the new things that you guys are doing in regards to taking advantage of this great service.
Yeah, so we have a website that's dedicated specifically for ePrescribe. The website is hseprescribe.com. Okay. So henryschineprescribe.com. And we have social media accounts and web pages that you'll be able to find online too. But you can also contact me directly. I'm pretty open to getting feedback, and if I don't know the answer, then I can point to who does know the answer and send you on to that person. So
perfect.
So I can share my email address too.
Okay. Yeah, that'd be great. Go ahead and let everybody in your email, and then we'll make sure, where the episode is listed, that all the information, like any of the text from the from the episode. We can go ahead and put all your information in this there. But yeah, go ahead and share it.
Okay, so it's ben.nielsen, and Nielsen is Nielsen,
Okay.
at henryschein.com.
Excellent. All right. Well, Ben, thank you so much. Really appreciate your time. You guys are doing some great work there. I'm at Henry Schein One, and I know a lot of the dental managers out there love getting feedback on what's new and how they can streamline their practice. So we appreciate you guys, and we'll talk soon.
Okay, thanks, John.
All right. Thanks, Ben.